Okay, welcome everyone. It is this week's edition of the coaching call. And today, the last 2 weeks, we've been talking a lot more kind of not philosophical, but a lot more mindset sort of things. And so as we have been going through what we want to discuss this week, we've had some really interesting conversations the last week or so about spinal degeneration, and so that's what we're gonna have a brief kind of concept talk on what we're meaning when we say some of these different terms. Things that we can talk about or we commonly refer to is degenerative disc disease, spinal degeneration, arthritis. There's kind of a handful of common terms that people, bulging discs, herniated discs, ruptured discs, disc compression, slipped disc. So, we can start to discuss kind of what some of those things are and what they mean, and we won't get into necessarily like what to do about them because that's a much larger episode. But just start a framework of like, okay, degeneration, what does that even mean?
What does it even mean? What does it look like? It's so fascinating to, I actually really love looking at x-rays and just really watching you describe, like, here's where we have some more bone formation and what does that mean? Why would how in the world do our bodies have that ability in the first place to start forming more bone, and why would it do that? And is that on to our benefit, or how can it be preventing us from having more mobility and flexibility and range of motion? Just all those questions.
Yeah, so normally kind of the progression. So over time, it's usually a pretty slow process. It takes about 5 years on average for degeneration to really be like present, and you're starting to see those signs and changes really show up on an x-ray. So as there is too much stress on a joint, a lot of different things all start to happen at the same time. You'll start to get an increase in inflammation. You'll start to get, typically, it's a result of changes in curve. It can be from a specific injury, but a lot of times it's postural, right? So normally in the spine, there's 3 curves that we want to see, and there's certain degrees that those curves should be. Those curves let the weight of your head, the weight of your body get distributed evenly through the spine so that not any one joint is taking too much stress. When those curves change, or other factors change, right? Like we're not getting as much exercise as we should. We have way too much weight on our body and our stomach. Then our gravity and the weight of our head and the weight of our body gets forced to specific areas. A lot of times that's lower neck and lower back, just because of the way the spine is formed. So imagine you weigh too much, you sit too much, you're not moving. Now you have all these forces and factors and gravity on top of that, all putting more stress on the very lowest disc in your back. Over years of that disc space gets smaller and smaller and smaller, and it gets smaller because that disc is becoming dehydrated. So a lack of motion and just the overall wear and tear is not pulling, the body is not able to pull in enough nutrients and enough water from the joints to counterbalance the excess stress.
Right.
So over time that becomes out of balance, and we'll see it on MRIs, because if we were to take an MRI of your back, each disc would be kind of darker around the edges, more white or light on the inside of the disc, which is where water is, hydration. And so over time that starts to decrease and the space gets much smaller, and then that's when a lot of other things really start to break down more. So as that disc gets smaller, your body, kind of going back to your original question, your body begins to it tries to protect that joint, and it does that by putting more bone there.
Okay.
And that's what most people are referring to as arthritis.
Wow.
Because it's extra bone formation.
Wow.
Yeah.
Okay. Now, would me drinking more water help me keep my discs hydrated? Can you describe the difference between what that really means as far as disc hydration and, it being either white or black, going black? Like what happens, right?
Right. That's what I've heard like that a lot the last couple of weeks. Is like I'll explain to somebody, your disc is becoming dehydrated. There's not enough water there, and so we've kind of been trained as a society, well, I need to drink more water.
Right.
Unfortunately that's not that is way different conversation. Like your body being dehydrated and the cells being dehydrated is not the same as your discs being dehydrated.
Right. Especially when there is a significant structural reason for those discs to be dehydrated.
Right. Yeah. It has almost nothing to do with what your water intake is.
So can you walk us through the process of how creating more space? I've heard you say that, just like you did, that if we create more space and then the bones, they pull nutrients from the bones, and then that.
Yeah. So in general, like a healthy joint, healthy spine and discs, motion in the spine pulls and pushes nutrients from the edges of the bone into the disc space. Your body wants to stay in homeostasis, and so as nutrients are pulled and pushed into the disc, water will follow that to keep things balanced. If there is no motion or there's too much stress, then your body can't pull or push enough nutrients into that disc space. And so if there's not nutrients in it, there's no water. And if there's no water, the space gets smaller.
And then what will people feel as a result of that? What are usually the manifestations of that?
Normally, people don't feel anything.
Interesting.
Until they do something silly, like reach behind them or pick up a sock off the floor, and now all of a sudden they have pain, or they wake up with numbness and tingling down the leg, or they swing a golf club and it didn't feel quite right, and now I have a lot of issues that would typically have gone away, and now they're not. They come in, we take x-rays. Unfortunately, that problem has been going on for 5, 10, 15 years. They either ignored it,
right,
or
now we're just
had no idea,
right.
And now we've got a bigger problem than what we really think we have, right? Because now we're dealing with not just the pain and inflammation that you're currently feeling, but we've got the underlying issue of degenerative disc and arthritis and bone formation that's could be pinching nerves or bulging discs, and so kind of that depends on where they're at and what's going on. But that normally, arthritis and degeneration is not painful.
Okay.
Until it is.
And you're vulnerable to the elements almost.
Yep.
You're just.
And you had no idea that it was starting to happen.
So, my question is when should we really start looking into the health of our spine? Like if preventatively, if we could go back and tell those people who are already in this position, when would have been a good time to start taking a look at the health of your spine, looking at x-rays, looking at the progression of stages?
If you polled 100 people, 99 or 100 of them are going to say, I know I have bad posture.
Okay.
Or I know that I sit too much, or I know that I've got 20 or 30 extra pounds that I shouldn't be carrying around. Like, all of those things are going to catch up, right? Otherwise, we are very, very good at justifying issues. So we'll say, well, my back hurts or my neck hurts. I just slept wrong. It goes away after a few days and now it's better again, so I don't need to do anything about it. Okay, if that is happening more consistently or over the period of 20 years, like, that's your body giving you some warning signs that there is something going on there. And so it's trying to decipher, what is really a muscle strain versus something else that your body's trying to tell you. It's really tough to do. We can't really take x-rays as just a screening tool.
Sure.
But we can take x-rays if you have a history of having issues or you're currently having issues, to really diagnose and find out what's going on.
Right.
But without x-rays, that's the only way to tell. I can't feel if somebody is starting to lose their joint space in certain areas. And usually an MRI is way overkill for that. So x-rays are the best bet to figure that out.
One thing I hear a lot also is, why can't we stretch our way or exercise our way out of some of that? Because you hear that a lot,
I just need to stretch more.
Right. I got to, Google let's just stretches, and if I just stretch or exercise, then
yeah. I think it should be part of it, right? I don't think there's a lot of factors that are going to go into it, right? You just like being overweight's a factor, not having strength or flexibility is a factor. Not getting proper motion in the joints is a factor, but not any one of those things is going to be the solution to fix the whole picture. Right. And oftentimes, what I have the conversation with somebody is, when you have a really degenerative disc, adjusting, you're past the point of getting adjustments and that going to be really what fixes it. You're way, way past the point of just doing some stretching and that stopping your disc from getting worse. Right? Like, yes, you should still get adjusted. Yes, you need to start doing some stretching exercises. But once you get to a point where, you really need decompression, or you really need to stop that degeneration from getting worse, you're kind of too late, and you're not to the point where you need surgery, but you're definitely to the point where you can't just stretch or exercise it away. It might feel good for a little while, but that's not fixing anything.
Right. The contributions. And so when we take a holistic approach to this, we're looking at it structurally, neurologically, also metabolically speaking. It's interesting to hear you say that. And the reason is you have said for every 1 pound in either direction, which is good news, is in excess 4 pounds of pressure on.
Yeah, so when you gain a pound or you lose a pound, it's going to affect your joints in your in your back, your knees, your hips by 4 pounds of pressure. So you gain 10 pounds, you just gained 40 pounds of stress and pressure on the joints in your back, your discs,
Wow.
your hips, your knees. You lose 10 pounds, you just took off 40 pounds.
That's incredible.
Of pressure, which is amazing.
Mm-hmm.
That feels way different.
Mm-hmm.
I mean, gosh, you lose 30 pounds and, you're completely different structurally.
Wow.
You're completely shifting around where you're putting all the stress at, because your body's not having to work as hard. It's not compensating as much. It's not it's a huge factor.
Wow.
So yeah, I mean, that's why certainly earlier, and when I was younger, people knew they were having weight was a factor in their spinal health, but it's tough to have those conversations. Now, I'm certainly much more comfortable, and we have the programs and tools to actually help people address those issues.
That's right.
Right?
Mm-hmm.
So, a common thing that you probably hear a lot more, and I hear, is, well, my doctor told me I need to lose 30 pounds, or 20 pounds, or 50 pounds, or 100 pounds.
Right.
And that's it.
That's it.
There's no
action plan.
Help
There's no
for that.
strategy. There's
maybe now there's
Right.
maybe it's you need to lose 100 pounds. Here's
right.
a medication to take for the rest of your life, but that's a whole other conversation.
That's a whole other conversation, which we need to have a conversation on.
Yeah.
Yeah.
So yes, metabolically, weight plays a huge role, and water and hydration does,
Right.
but not directly for your disc. So if you're worried about having degeneration in your discs, drinking more water in general is healthy. It's not specifically going to impact the disc space.
Right. Just like the way that you go about your meal strategy. It's not going to do anything to the disc space, but it can help with systemic inflammation all around, as far as creating a better pathway to your healing, as far as cellularly
Yep, 100%.
speaking.
100%. And so, that's kind of, when we say degenerative disc disease, arthritis is typically, all of those are really related terms that get thrown around.
They do, because I've seen you draw pictures on an X-ray, draw lines on an X-ray, and that decrease in disc space means that disc needs to go somewhere, but it can go in a lot of different directions, which is surprising. I don't know if you've ever thought of that picture in your head, but it is surprising where that disc can go and where it goes, how it impacts the nerves, or it impacts your pain, or what you're actually feeling, or what's actually happening there.
Yeah, so if you stomp on a jelly-filled donut, who knows what direction that is gonna
That's a good picture.
go squirting out, right?
Yeah.
Same thing happens with your disc. You're getting compression. Sometimes that goes straight back, sometimes that goes back but to the right, sometimes it goes back but to the left, sometimes it goes forward. Just completely depends on a million different factors. And then that's where different terms like bulging disc, herniated disc, slipped disc, which isn't a real term, but doctors kind of explain like, hey, I slipped my disc.
Right.
It's really just a bulging disc.
Right.
So you've got bulging disc, herniated discs. Herniation is more of what happens to the inside of the disc. And so there's a lot of different nuances kind of inside that. But most people, it's degenerative disc disease is like the broad term and most related to a lot of people. And then as bones developed, and that's really what our arthritis is.
Yes.
And then you've got varying levels of different disc bulges and disc conditions, I would say.
And what's fascinating about that is depending on which direction it's going can be the difference of you having numbness down your legs and into your calves and into your ankles, which is also kind of incredible to see. So
yeah, the level of spine and where the disc is bulging or which nerves are being compressed completely changes like where you're going to feel symptoms and stress at. What's confusing for a lot of people is they'll have numbness and they won't necessarily have back pain, but they'll have numbness and tingling down the leg. And, you know, well, I'll tell them, like, if you're going to heat or ice, you don't need to do anything to your leg. You need to do it to your back, which is, you know, until you see a picture of what your back is doing, like, it's hard to relate those two things.
It really is.
Because we're so much like, well, my finger hurts, so there's a problem with my finger.
Right.
Not a problem with your finger. It's a problem with your neck, which controls your finger.
That's right. And also incredible enough is you don't have to live with those things. It doesn't mean necessarily that you have neuropathy. It doesn't necessarily mean, but there are proactive preventative approaches to actually address those.
Yeah, I mean there's a lot of things you can do preventatively. And, you know, let's say you haven't realized you've had a lot of issues and now you do, there's still, I mean, advancements in technologies are taking off on conservative things to avoid surgery.
Yes.
Right? Like the closest thing that we can do conservatively, like with people who are really worried about surgery or they've been told they need surgery, is the decompression, which is opening up those disc spaces. It's trying to rehydrate those discs and just get some more of that hydration back into them. Enough to take pressure off of nerves and give some relief. Sometimes that totally prevents surgery, and sometimes it's just prolonging it until, you know, to try to, you know, not have it at some point.
And being consciously aware that that's going to take time and consistency. It's not just going to be an in and out you're going to do.
Yeah, if you've had 10 years of 15, 20 years of slow degeneration on a joint, you know, we're not looking at 5 visits and you're going to be healed. Like it's like minimum 12 weeks for a really degenerative disc to begin that healing process.
Wow.
So, shedding some light on hydration and disc hydration and what that means. And so, you know, we'll continue this conversation on at some point on, you know, specific things people can do to be more proactive with their disc, but just kind of a general explanation of, okay, here's what degenerative disc means, how people have gotten there, and more importantly, what it doesn't mean, which is, you know, you're just not drinking enough water. Yeah, which is, you know, it's a common, we hear it a lot. Yeah, so if you have thought that, you're not alone for sure.
No.
But let's set the record straight here. It's not just a lack of water. So fantastic. If you have any questions specifically about degeneration, arthritis, what degenerative disc means, you want us to have some additional conversations on kind of this topic and you know, breaking down what some of these giant medical terms mean, happy to do that. Leave a comment in the section below, leave a comment in the comment section, and we'll take a look at that. And certainly, if you have any issues or concerns, or you're worried about your own arthritis, degeneration, disc, what does it look like? Feel free to reach out to the office. There's a lot of screening tests that we can do, and tools that we can figure out how to best serve you. So until next week, have a great one.